Sudden cardiac death accounts for approximately 400,000 deaths in the U.S. today. In fact, the out-of-hospital survival rate is less than 1% unless you have one of these guys right here. Dr. Kevin Campbell here this morning to show us how to work an AED and also to talk more about that. Doctor, good to see you again.
Good to see you.
What exactly is an AED?
So an AED stands for automatic external defibrillator. What an AED does is in the setting of a cardiac arrest, it allows us as bystanders, whether we're medical personnel or not, to give the heart a shock and reset the heart rhythm, saving that person's life.
The impact on the survival rate using one of these, what happens?
So we know that AEDs improve survival significantly. If you get quick defibrillation when you are in cardiac arrest, the survival rate approaches 70%.
Wow.
Without a shock, it's less than 1%. These things should be everywhere, in churches, in schools. I think they should be at every athletic field for any high school practice, any high school game, because the time to save a life is a matter of minutes.
Clearly, you also have to know what you're doing when using one of these as well. I'm sure there's some training that you have to go through.
So we create classes through the American Red Cross that are available to church groups, civic groups, any group that wants to learn. There's also companies out there who will come and train you. The training's very easy. It's included with basic CPR. However, that should never preclude you from using an AED if you see someone who has collapsed. The first thing you need to do is make sure that you check on that person and begin basic CPR, but also activate EMS through calling 911.
We have one of these here at the station.
Exactly.
I've never gone through training. If something should happen to one of my coworkers, what do? I pop this open,
so
right?
You pop it open, and it will start talking to you. It's setting itself up right now. And
stay calm. Follow these voice instructions. Make sure 911 is called now.
Wow.
And it'll
begin by exposing patient's bare chest and torso. Remove or cut clothing if needed.
So it kind of walks you through what to do.
Exactly. And then it'll give you actual patches to put on the patient.
Okay.
And then if a shock is advised for that patient, it'll tell you to move back. It will shock the patient and then tell you to start doing CPR. So really, even without training, you could kind of get your way through this and save a life. That's the most important thing, saving a life.
Absolutely. Good to know. Doctor, always good to see you.
Thank you so much, sir.
And of course, if you have a question for Dr. Campbell, really easy. Log on to our website, WNCN.com, search the links we mentioned section. From there, you can find Dr. Campbell's website, his Facebook page, and his Twitter.